This is the campus of the University of Wisconsin at Madison. 1/2 century ago, a professor of this very university performed the first successful bone marrow transplant, saving the life of a boy with Wiskott-Aldrich syndrome. Today, in this sealed off-access lab in the heart of University Hospital, another team of research scientists and practicing physicians is pushing that historic legacy further, testing a breakthrough technology with life and death consequences for transplant recipients.
The laboratory, you cannot just walk in there. Access is very restricted. Only really trained personnel that has to work there goes in. So if you get a chance to look, you got really lucky, because I don't get to go to that lab. I cannot just walk in there, even I'm the medical director.
Our role is to go where no one has gone before. A bone marrow transplant is a procedure where we, in essence, wipe out your bone marrow. Wipe it clean. And if we do nothing else, within 2 weeks, you would die. But the day after we wipe clean your own bone marrow, get rid of every last single cell, we come in and give you a little bit of bone marrow that was harvested from a relative, could be a parent, a brother, a sister, or a child. That's a good match. And they grow and repopulate and grow a new crop of bone marrow. And there you are, having the bone marrow of your relative and not your own anymore.
What we need to do in order to get these donor cells, the cells from another person, safely into the patient, we need to suppress the immune system. But here comes the problem. When we suppress the immune system, we also suppress all immune defense against any type of infection the patient can have.
And these dormant viruses, like Dracula coming out of his sleep, come back and start replicating, and there's nothing to check them. And it can be a death sentence. There's no solution. We're addressing an insoluble problem.
The cutting-edge Program for Advanced Cell Therapy was formed to address this very kind of vexing problem.
We select a donor that can be a relative of the patient, and then we take their white blood cells.
And we can pluck out those immune cells that are specific for the virus, because in our blood we have immune cells that are specific for this or that, specific to the virus.
And we're going to only take those and give them to the patient.
Then they eradicate the virus. And that's cell therapy.
If we make this therapy more accessible, then really that could be a huge game changer.
We're now launching our very first clinical trial.
We're going to enroll 20 patients. We want to make sure it's safe and that we can do it very efficiently and properly.
And our staff are excited to participate in deploying something that may make the difference in the life of a little girl that got a bone marrow transplant that's got a dreadful reactivation of CMV virus.
And if you want to solve big problems, then you need to put big ideas in.
And that's what informs the narrative of becoming a national destination.